I'm Sammy from Davenport Community Center. I would like to give you a flyer.
It's not always easy.
Hello.
People don't always stop to listen.
Groceries, access to resources.
But they keep trying.
I don't want to take any paper.
Okay, no problem. At least he listened to what I had to say. That's a good thing.
Sammy Mensah and Romeo Osas Joshua are youth workers with the Davenport-Perth Neighbourhood and Community Health Centre in Toronto's West End.
So just contact Davenport if you need any of this. Nowadays, everybody's getting information from the phone, but some people are old school. Some people need flyers. Some people need interaction.
I'd like to give you this flyer.
They've been enlisted to spread the word about COVID supports in the area and to hopefully start a critical conversation.
Once they give us a call, that usually tells us that they're interested, they need our help, we have their attention. So that's when we'll take a few minutes and talk about vaccines and, see, how far we can get with that topic.
Sammy is only 20 years old, but he already has clout in the community.
COVID has affected all of us, everybody of all different ages and backgrounds. Us letting them know that even though we may be young and strong, we still feel the need to add that extra layer of protection by getting the vaccination.
Protection is sorely needed here. COVID has hit some pockets hard. Racialized areas where there are many essential workers who often live with several family members in close quarters. But while people here are among the most vulnerable, they are among the more hesitant too.
We're definitely a community that has a higher risk of contracting COVID-19, as well as why we really do need to let them know that the vaccines are important.
Tamara Largy is in charge of the COVID response team at the centre. She's been hearing the same concerns from the start.
They kind of use us as a guinea pig to do these things first, and then they see what happens to us, and then people who are more well off, they will get it after. Let's see how the poor people or how the people who are suffering challenges do first, right? So that's always been one of the remarks that we get a lot. So that's where we see a lot of hesitancy as well.
With the help of Sammy and his peers, the centre offers supports like pop-up COVID testing in the community. It's part of a localized response to COVID that is shifting to vaccine readiness as well. Because leaders here know the best shot of breaking down hesitancy comes from within.
Because there's a lot of memes and things going around about why you shouldn't get the vaccine. And as well, young people, they say, well, I'm untouchable. It's an old people thing. I don't need the vaccine. So really getting out there and letting the community aware that vaccines are coming. They're starting to pick up, which is great. Let's be ready to get them. So let's work as a team, right?
Protecting the most vulnerable. It takes a village. At this seniors' residence in Toronto's East End, a vaccine education campaign began weeks ago. Not for the residents, but for the caregivers. Unlike other facilities, the majority of staff here agreed to get their shots when their turn came, including personal support worker Flora Santos. She says it's because she knew enough to feel safe.
Our administrator, they're always giving us the update. What is going on about the vaccine and everything. So everything is so clear to us that it's safe to have the vaccine.
Was it an easy decision?
Yes. Yeah. Right away when we heard about the vaccine, I said, I am getting it. And everybody said, well, I'm getting it too.
The awareness campaign here was supported by local doctors like Dr. Tia Pham from the Toronto East Health Network.
So you've noticed that in places where there is a lot of education, awareness, fact-based information, the uptake is higher.
Absolutely. And, at the same time, also a sense of caring, right? You're supported throughout your organization as well. You can have these conversations.
What is the reluctance on frontline workers like PSWs? Like, why would they be reluctant if they've seen the impact of COVID up close?
I think some of it is just it's different populations, right? So we have a diversity in populations. And so much of it, I think, there also lies in convincing them that this vaccine has been studied not just in the average population, but really across different communities of a diverse range to build that vaccine confidence. And then really having community leaders step forward, speak up, get the vaccine and lead the way.
These communities have been leading the way from the start. They made and recently won the case for priority vaccination. In the next few weeks, vaccines will roll out in neighborhoods with high rates of COVID transmission. With the support of health partners, it's the people who live here who are managing the concerns around them. In Flemington Park, a transit bus, transformed into a mobile COVID testing site, parks in front of buildings where COVID rates are high. And there's already talk of using buses as mobile vaccine sites. The convenience is a huge draw. And from testing to vaccines, the approach is the same. Meet people where they are. Shabna Miraj and her daughter Hafsa Fatmi live in this nearby building. At least once a week, they share flyers with the latest news on COVID resources in the area. Flyers about vaccines are coming soon. The message and the messengers are all close to home.
If people know you, if people trust you, they listen you. You are here to help them. So then they do. Like, you know, when you talk to them, they feel some connection to build the trust.
Building trust, it comes one creative step at a time. Hafsa is also working with a college student to develop a podcast featuring nearby community leaders like Ahmed Hussein.
What we are really doing is community outreach.
Ahmed runs the neighborhood organization in Thorncliffe Park. Today, they're interviewing him at the center's future space.
Do you think there's going to be any challenges when it comes to advocating for the vaccine?
This is huge. It has never been done. There will be challenges, but we are prepared to address those challenges with our...
The community has hosted several virtual town halls. The podcast is one other source of information, tailored to the diversity of residents here.
A lot of people had a concern of it being halal or not, so they were like, what's the ingredient list, like what's exactly going inside my body? So we're just hoping that this podcast would help people and like educate people and like actually want them to actually get the vaccine because so many people are unsure of it.
Ahmed is hoping this space is a strategic one too. He's been advocating to use it as a mass vaccination site and just got word it will open as one later this month. The hope is residents can walk over and be the first in line.
How do you think this space will help with the vaccine hesitancy?
It's in our backyard, so we don't have to travel to go to get our shots. Just come down from their building, in 200, 300 meters, they are here. When they go back to their buildings and they are okay, nothing happened to them, they're safe and sound, I think that will give incentive people who are worried about health impact of the vaccine.
So questions about specific vaccine, what is it?
The show rather than tell approach is already in the works. Tabassum Mohammadi is a community ambassador. On this day, she's facilitating a call between a public health expert and residents who have questions about vaccines.
Okay, Jamal, do you have a question you wanted to ask?
So I have a question about if someone already has COVID.
Tabassum hasn't gotten her shot yet, but several other outreach workers like her already have.
They will play as a role model for the rest of the community. So the people who are hesitant will definitely feel more safe when they see other people getting vaccinated.
Great question, Jamal. Thank you so much. So
the growing awareness seems to be helping.
I've noticed the questions are much more detailed, like what choice do I have for a vaccine? Will I get COVID in between doses? So there seems to be a softening.
There is, yes, there is. Because initially when the vaccine came up, people got scared watching the social media, and once they are hearing more about vaccine, they want to come back to their normal life. Thanks for joining.
Bye, everybody.
This is all about looking forward. Back in the West End, Sammy and Romeo are still at it. Still hoping with the right information, people here will trust those closest to them to help get their lives back. Joanna Rumiliotis, CBC News, Toronto.